Let's give you an update then on the COVID-19 situation in the country. The National Institute for Communicable Diseases has reported 1,420 new COVID-19 cases in the country. This brings the total number of cases to 3,722,065. The majority of the new cases are from Gauteng with 548 cases, followed by the Western Cape with 354 deaths from COVID-19 related complications were recorded, of which 2 occurred in the last 24 to 48-hour reporting period, bringing the overall death toll to 100,046. All right, well, health authorities have found a new coronavirus variant spreading in the UK. The mutant is said to appear to be 10% more transmissible than the BA.2 subvariant of Omicron. So far, BA.2 was deemed to be the most contagious of the COVID-19 variants. The newly identified variant is a mutation of the BA.1 and BA.2 Omicron strains, referred to as the recombinant. As per the initial studies, the XE variant has a growth rate of 9.8% over that of BA.2, also known as the stealth variant, because of its ability to evade detection. For more on this, we're now joined via Zoom by CEO for High Health, Professor Ramneek Ahluwalia. Prof, it's always a pleasure to see you. Thanks for availing yourself to SABC News, sir.
Good afternoon, Flo, and good afternoon to everyone. Such an honor. Thank you.
Prof, let's talk about this particular variant and, how dangerous it is. I mean, as I'm reading this intro, it seems very contagious, very scary. What are the concerns and what should we be concerned about? And I mean, in particular, your concerns about this particular variant?
I think for now, there's no panic, to be very honest, to begin with. But what we have to consider is that WHO has provided quite a bit of information about this new variant called XE. And we know that, the COVID virus historically has shown to be highly mutating virus, which means it's continuously trying to change its color and shape. What we are seeing now is that there are 3 forms of how this virus is behaving with. One is this virus is trying to become over-infectious, which means every time we saw Omicron among the 5 variants of concerns we had in amongst the COVID-19, Omicron was the most highly transmissible one. Seems like the one XE which we have seen now is 10% more than transmissible than its previous predecessor, which is Omicron. The good thing is it's coming on still from the Omicron family, which means there is enough natural immunity and there is enough vaccine immunity that the humans have to prevent like they did for the Omicron. The second thing that we are going to be watching now, which the WHO is going to be keenly on, and our scientific world will be doing, is to watch what we call it as it's clinical patterns. Does the disease changes in clinical surroundings? We've seen with BA.2 of the Omicron that the clinical symptoms were far different from even the BA.1, which was the Omicron, the original Omicron that came to South Africa. And what we're going to be seeing is it becoming more virulent? And that's going to be watching in our space at this moment, and that's going to be what we're going to be seeing. The third thing that we're going to be seeing is what we call it as escape mutations, or will our immunity be very strong enough, and will this virus still try to escape our immune system? All the virus will keep trying to do is it goes and changes its shape in such a way that our immune system does not recognize it, giving it a free flow to bind to the human cells, eat from our human cells.
Yeah.
So this particular X is a recombinant virus, which is very common in the viral history, in viral evolution, which means in a same human cell, both BA.1 of the Omicron and BA.2 of the Omicron were together. They worked together as 2 viruses, developing a genetic transfer of their materials. We call them antigens. And what has happened is developed themselves into a new shape, which is a combination of both BA.1, BA.2. And that's what the WHO is trying to explain, call a recombinant variant, and is calling itself as an XE. So I think there is a variant of concern in mind. but we have to watch whether our immune systems will be good enough, which we think will be, and so there's no sign of panic for now.
Prof, you said something very interesting. You spoke about the fact that there might be at this stage enough natural as well as a vaccine immunity. How did we get to that balance? And I'm talking on the back of the fact that, there was a lot of talk about vaccinations, and in fact, in some cases, people were being told, you're being forced essentially to take the vaccine. But there wasn't a lot of talk about natural immunity. But it's interesting that you point out the issue of natural immunity and that of vaccine immunity. You've said that it seems as though there's enough. How did we get to that balance, and when did we reach that particular balance?
So studies have clearly shown in South Africa that over 75% of our population did get COVID, whether it was during the first wave, during the second, third, or the fourth wave, specifically around the fourth wave when Omicron came, which means that humans acquired immunity for this novel thing that was into human mankind. We never had immunity, but we started building immunity in ourselves. And then what we supplemented further was what we call it as a vaccine immunity. Lots of South Africans, to be very precise, above 60% above the age of 60, and about at least 30% above the age of even 18 have now taken vaccination. What does that give is that natural immunity or the acquired immunity is now added with what we call it as a vaccine immunity. Now, what the world has to watch is in the immune system is that every immunity, it weans off with time, which means our natural immunity or even a vaccine immunity does wean off with time. And that's why the scientific world says, get your boosters and timely boosters, because what we're doing is while the immune system starts dropping, the booster will pick the immune system back to its right phase, and that will eventually help in the body to fight these new variants. So what is the concern is that there'll still be possibilities of breakthrough infection, which means even if you have acquired an immunity in the past or you had a vaccine immunity, these new variants will have a possibility of escaping the immune system for a while, evading it, not being recognized because of the mutations, and will cause infection to you. But what we clearly see is because there's some kind of an acquired immunity or a vaccine immunity that remains because we got first, second, and third line of defense. And by the time a third line of defense picks up, we will be able to, and that is where ICU and deaths can be averted away from it.
All right.
What we have to clearly see is that Omicron is a virus which was less virulent, but there are offsprings of Delta, Alpha, the Beta, which caused massive deaths in South Africa. Those viruses exist, and they are also mutating. And that's what WHO has still said, that as much as we're talking about XE, which is obviously seen to have taken popularity in UK, we've also found something called an XD and XF, which is a mutant, which is a combination of Delta and an Omicron. And that is a bit of a concern because Delta variant was considered to be more virulent, which means the clinical patterns were stronger. And I think that's what the world will be watching of these recombinant variants and the mutations going forward.
Prof, always a pleasure. Thank you very much for giving us that information. That's Prof. Ramneek Ahluwalia, who's the CEO